Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Cernăianu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome back to another episode of the Wellness Optimizing Warrior MD. And I'm talking so much about hormones and hormone-related issues. I'm considering a name change for next year, coming January 1st, so stay tuned. I also apologize for being a little congested and nasally, but I got a little bit of a flu. Obviously, it's not going to hold me back from recording another episode for my listeners. And today, I'm recording part 2 of the series discussing natural solutions for vaginal wellness after menopause. So I am reviewing options for addressing vaginal wellness problems caused by aging and by the loss of estrogen after menopause, which, if you remember, is called GSM, which stands for genitourinary syndrome of menopause. So in the last episode, I talked about solutions to treating and addressing recurrent urinary tract infections that were caused by postmenopausal changes. And I also talked about how important sexual intimacy with a partner was for maintaining vaginal wellness. I talked about over-the-counter lubricants, and one of them was hyaluronic acid. So I'd like to continue along the line of vaginal lubrication as being one of the main problems, if not the main problem with intercourse, because it's the loss of moisture caused by the loss of estrogen after menopause, which translates in the very serious vaginal dryness problem. Obviously, the tissues in the sensitive vaginal canal and the vaginal opening will suffer a lot of thinning on top of the dryness and will lose their elasticity, which will contribute to the pain and discomfort in this delicate area as women age and attempt to be intimate. So I want to start this episode by talking about one of my favorite solutions for improving vaginal wellness, and especially for moisturizing the intimate skin of the vaginal canal and the vaginal opening. This is really one of my top favorites, and you might have heard of it. This is DHEA. DHEA, obviously, it's a pro-hormone made by the adrenal gland, can be taken as a supplement. It's very important for your body, and your body will get depleted as we age. Whether you're a male or a female, you will run out of DHEA eventually. Not completely, but it will be very depleted. And DHEA will also be depleted with certain conditions like recurrent stress and what modern medicine does not like to recognize, called adrenal fatigue. So it's expected to decline. So let's call DHEA dehydroepiandrosterone is a pro-hormone, and I'm pretty sure I talked about the benefits of DHEA in a previous podcast, maybe about 2 years ago. But what I don't want you to do is confuse the oral supplementation with DHEA with vaginal DHEA for menopausal issues, for atrophy during lactation, for breastfeeding mothers. So do not confuse the two. Now, what is interesting is, well, oral DHEA works really well and helps with a lot of things. So you'd believe, well, it could technically help the vaginal tissues. It doesn't, not really. DHEA has to be administered and applied in the form of a cream or a vaginal suppository directly to the tissues of the vaginal canal and to the vaginal opening in order to see the improvement of the dryness and the tissue quality. And many women do. Sometimes that's all they need, and it works really, really, really well in the absence of estrogen. There is an FDA-approved product for DHEA called Intrarosa. It contains bioidentical DHEA plus a lot of other ingredients, which you can look up online. It has a significant downside of being somewhat on the expensive side. And it has very inconsistent coverage by various health plans. And another inconvenient downside is a very large number of doctors who treat women, postmenopausal women who need this solution, have never heard about it. They don't know about it. Now, I doubt that there are practicing board-certified OBGYNs with experience that do not know about it, but it's very possible that the more senior practicing physicians who are really busy in their day-to-day practice, they're probably not necessarily going to a conference where they might have found out the benefits of the vaginal DHEA. Maybe they don't know. But I guarantee you, your family practice doctor is not necessarily very well versed in this. So when you go for your annual checkup with a PCP or primary care doctor or family practice physician, even a mid-level practitioner, they might have not heard of vaginal DHEA. So there used to be a time when the big pharma reps will come, will visit the doctor's office and leave pamphlets, will leave some studies. These studies will highlight and illustrate how their product will benefit the clientele or the clinic patients if it was a community clinic. That's going on a little bit. But unfortunately, for an obscure product like vaginal DHEA for postmenopausal women, I've never had a rep come to visit me about this product. But I have a lot of reps visiting me about birth control pills, about other drugs with big pharma, especially drugs that relieve vasomotor symptoms and other things. But so anyway, the good news is that the word travels fast. Women talk to each other, and hopefully doctors will stay in the know and will keep up with menopause treatments like I like to do. And this will become more and more to the forefront of one of the most effective tools we have to help vaginal tissues quality after menopause, because it works like a charm and there's no estrogen involved. So again, unless your doctor is a gynecologist, your primary care doctor might not know about Intrarosa. I found out about the benefits of DHEA either by itself or combined with estriol, which is a very weak estrogen, over 10 years ago. I believe it was probably a pharmacist who told me about it. Now, obviously, this pharmacist was simply trying to promote their compounding pharmacy, but in the process of getting me to become her client, she provided extremely useful information, which helped me in providing better care and helping a very large number of women who are now extremely happy and satisfied with their vaginal wellness because of compounded DHEA or the compounded DHEA estriol combination. Now, I spoke about estriol a little bit in one of my last episodes. I'm going to refresh your memory. Estriol is an extremely weak estrogen. If estradiol, which is the main estrogen, if its potency is 1, so estradiol potency is 1, then the estriol's potency is 80 times less. So it'd be 0.0125 compared to 1 for estradiol. And estriol is also incorporated in many bioidentical compounded formulations that are administered systemically that many women use, and they're not aware that it has estriol in it. It's called biased. So biased means dual estrogen action, estriol, estradiol. And if you see 20/80, be aware that 20% is estradiol and 80% is estriol. So that product might be very, very weak in a systemic form. Anyway, let me go back to vaginal estriol. It is extremely helpful, not only because it will absorb into the body very, very little, but because it belongs to the family of estrogens, it will help nourish the vaginal tissues probably much better than the DHEA. But that's why I like this combination, because their effects are synergistic and complementary. The DHEA cream or the DHEA estriol cream, usually it's used daily for a week or two, and then 2 to 3 times a week, bedtime, just for maintenance. The DHEA estriol cream is obviously a step up and a more potent solution in addressing the vaginal wellness issues that are brought along by aging compared just to the hyaluronic acid or to the other over-the-counter lubricants. Because while using hyaluronic acid or other lubricants gives you immediate relief, that is extremely temporary. Your symptoms will return immediately as soon as that lubricant will dry off. And if you don't take the lubricant or don't use the lubricant, it doesn't do anything, right? But with the DHEA, the estriol combination, or either one alone, if you use it regularly and then suddenly you stop, it can take weeks to months before your symptoms come back. It does change the quality of the tissues. So it's not the end of the world if you run out of your prescription for a few weeks. But if it's been more than 3 to 4 weeks, please make an appointment with your doctor to get a refill. It is important to continue and be consistent. Remember, a woman's vaginal tissues continue to age just like our face does, just like the rest of the skin on our body does. And we always like to do stuff to keep up with the skin on our face. You need to do the same thing, and we need to provide some form of moisturizer, action, or solutions to the vaginal tissues as well. There are devastating consequences of aging on our skin if we do nothing. So most women that I know, when they look in the mirror, they always apply something at night, in the morning. They do take care of their skin. Remember, doing something for the vaginal tissues as well will be preferable to doing nothing. And continuing along the line of discussion of natural solutions that are non-estrogenic solutions, let me talk a little bit about the benefit of vaginal devices in maintaining vaginal wellness as a woman ages. I've talked earlier about how beneficial intercourse is for a woman because it improves moisture. And by itself, intercourse will significantly improve the quality of the tissues. If a woman is going through menopause and she's been through menopause already, she's on the other side, she might be in the 5th decade of her life. If she finds herself single and not dating, it is important for her to understand that maintaining vaginal wellness will be vital for when the time comes to meet that special someone, when the time comes to make a connection with someone who is worthy of being intimate with. Her vaginal tissues should be able to sustain the intimacy and allow her to enjoy the act of newfound intimacy with her new partner. I've had many women confess during their consultation that they were unable to be intimate with a new partner, which caused them embarrassment, shame, and unfortunately created some PTSD around the attempt to be intimate again with the same person or with someone else. Now, when you're young and healthy and you have good hormonal balance, especially very optimal estrogen levels, these optimal estrogen levels will give you a vaginal bleeding event every 25 to 35 days on a regular basis. At that time in your life, it doesn't matter if you take a 6 months, a 2 years, or a 5-year hiatus of pelvic rest. And it doesn't matter if there's no vaginal intercourse for a long period of time, even years. As long as you have estrogen, your vaginal tissues are healthy, lubricated, moisturized, elastic. And at the time of the relationship with a newfound partner, a lot of healthy love hormones like oxytocin, testosterone, etc. will be easily produced and released. So the act of intimacy will come easy. It will be natural. Now, if a woman has been through menopause and she's now, let's say, 2, 3, 4, 5 years or more without any partner or intimacy, because let's be serious, the statistics indicate that there's a very high chance of divorce when women go through perimenopause, and women can find themselves at menopause single and needing to date or after menopause. And if a woman has been without intimacy or without a partner for a very long time after menopause, she should be concerned with the fact that the act of intimacy with a new partner could be complicated by vaginal discomfort. And consider the fact that this discomfort might be too much to bear. And if a woman is not on hormone therapy, and if she really hasn't paid any attention to her vaginal wellness, it's very possible that the act of intimacy might be impossible due to vaginal dryness and pain. Now, again, we have the love hormones to come into play. When you're in love, there's a lot of oxytocin. There's a lot of testosterone being produced. There's a lot of natural things that happen that will improve the process of lubrication. But if the tissues of the vaginal canal have suffered dryness and they've been damaged and thinned out by the loss of estrogen, that might not be sufficient to allow enjoyable intimacy. Obviously, this is not necessarily true for all women, but unfortunately, it can be true for a pretty significant amount of women who fit this situation. The natural order and progression of vaginal changes without estrogen will happen, whether we like it to happen or we don't want it to happen. It will happen. The vaginal tissues at the entrance and the inside of the vaginal canal will thin out, will become inelastic and dry. It will lead to difficulty with intercourse. So what can we do outside of estrogen and just simply hoping that this kind of situation will not apply to us? Well, there are vaginal devices. I have one that stands out and I really recommend it to my patients. I carry it in the office to make sure that women have it available when the discussion happens, which will increase their degree of commitment to buying the device and actually using the device immediately as soon as they go home. So let me say a few words about this device. This is a home use red light therapy device, which looks like a dildo, but it's not. It will not give a woman an orgasm. It is used purely for the medical condition caused by the loss of estrogen after menopause, which is vaginal atrophy. And interestingly enough, it has an 80 to 90% chance of improving the vaginal changes caused by the aging of the woman, caused by the menopause changes and the loss of hormones, by doing these three things. It emits a red light, it vibrates, and it generates a gentle heat. The device is used usually 3 times a week for a maximum amount of 10 minutes. And obviously, you start at about 4 to 6 minutes, and then week or two, you increase to 8 minutes and then to 10 minutes. And once the improvement is achieved, which takes about a month, and the desired outcome of the improvement of the moisture and the tissue quality is significantly better, allowing intimacy without any discomfort, the device is just meant to be used once a week, ideally twice a week for 10 minutes. In a woman that's sexually active, once or twice a week, that's probably not necessary. But if she's not on any hormone therapy, once a week, intimacy might not be enough to stimulate the local processes of healing. So the device is highly recommended to be used. It costs about $400. It comes with the approved biophotonic gel that actually contains hyaluronic acid and aloe vera. It can also be used during the act of intimacy. And obviously, please, if you do buy this device, don't use it with other types of gel because the area of the device, which emits the red light and the vibration, can get easily damaged in the process of cleansing with any other lubricant except for this approved biophotonic gel. Now, many women continue to enjoy sexual feelings, even without a partner, and they continue to pleasure themselves, which is a very healthy manifestation of their sexuality. The ability to have a clitoral orgasm should not be used as an indicator that the act of vaginal penetration is going to be painless. If a woman does not have a partner post-menopause and she's not interested in dating, but would like to reserve that option for the future, it would make sense to discuss her ability to be intimate with a partner during her annual gynecological exam. Again, I know many women go to their primary care doctor and they believe that the pap smear is the most important thing they should do once or every 1 to 2 years. However, considering the significant vaginal wellness and urinary health changes that are guaranteed to happen in 80 to 90% of women after the age of 55 to 60, I strongly advise all women to have a gynecological exam with a GYN experienced provider. Because if there are vaginal wellness tissue changes, a meaningful discussion and options for treatment can be offered immediately. Because as gynecologists, we're trained to look at that area and we know immediately that we are confronted with a problem and we need to act early before it becomes even worse. Coming back to the vaginal device I mentioned earlier, which by the way, it's called VFit. The point I was trying to make is that If the vaginal exam during your annual checkup is already uncomfortable, that should be a red flag that you will likely have a very similar experience when you attempt vaginal intercourse. So if the vaginal device I was mentioning earlier, the VFit, is not in your budget and $400 is too much, you can consider buying a cheaper vaginal device. Maybe one that does not emit a red light or a heat or a gentle heat to promote moisture and blood flow. But there are lots of them that provide vibration. Using a personal pleasure vaginal device, again, not necessarily clitoral, that's going to help you enjoy the device, but it's not going to give you the medical benefits of the device. This personal device could be an important tool in maintaining your vaginal wellness. Now, if you have trouble like recurrent UTIs or recurrent vaginal infections from it, you will probably have to see your specialist. It means that we need to work on the vaginal wellness and the microbiome, maybe for a very short period of time with vaginal estrogen or the DHEA estriol that I mentioned earlier. Then you can follow with the personal device. I do have a very large number of lasers in my private practice that target vaginal health. And what's very interesting to me is that once I recommend the treatment and women see the results, they don't necessarily focus too much on preventing the recurrence of the condition that they had initially. And I say that because many times as a specialist of vaginal wellness and as a physician who has a pretty large amount of vaginal wellness lasers and devices, when I treat the patient and they come back and they're happy, they're like, it's all great, I have no more problems. Many women, once they feel better, they literally just walk away and they don't come back until the problem comes back. So I do think that one of the key messages I want to deliver with this podcast episode is that an ounce of prevention is worth a pound of cure. You need to think ahead on how to prevent the problem coming back. So when patients ask me when they come back and now they have the problem again, they're like, okay, well, what do I need to do so it doesn't come again? I'm like, well, I did say you need to come back for an annual maintenance treatment. And that didn't happen. And one of the analogies I use a lot to explain the need to come back for another treatment once a year, every 6 months, or it's different for everybody. And the question I ask my patients as an answer to their question is, do you go to the gym or do you exercise? And what kind of exercise do you do? And then the patients say, well, I walk every day. I run every day. I lift weights every day, 2 times a week. I go to yoga every day. It varies. So they always say, yes, I go to the gym. Yes, I exercise. 9 out of 10. I guess my patients are really good about that. So the answer I give back once I hear how they exercise and how committed they are for their physical wellness, I say, once you have improvement in your vaginal and urinary wellness, you don't give up. You join the vagina gym or the bladder gym and you keep going. Maybe not at the same rate that you needed as far as the sessions of, let's say, strengthening the pelvic floor or addressing the quality of the vaginal tissues, but you do it once a year if it's for vaginal tissue quality, every 2 to 3 months if it's for pelvic floor maintenance, and you continue doing the vaginal lubrication, DHEA, estriol, VFit, whatever it is, regularly to prevent the problem coming back. So many women buy the device, use the VFit, they get the improvement, they're happy, and then something happens either to the relationship, and then they have a breakup, and now they're single again, and they stop using the device. And when they come and I do the exam and I notice there are changes, I ask them if they're using the device that they bought. And they admit, oh yeah, I fell off the wagon, I forgot. So I kindly remind them that if it sits in their drawer, it will do nothing for them. So just like I said earlier, vaginal intercourse is useful to allow lubrication and to allow moisture. Simply the act of regular intimacy can help maintain vaginal wellness. And so does a personal use device in the absence of a partner. Don't wait too long, because if you're not involved in an intimate relationship with a partner and you're after the age of 55 with limited or zero prospects of dating because you're too busy, you have a busy career life or busy family life, you should consider using a personal use device if you don't have a partner. It might not be as effective, but if used properly and regularly, it can help maintain patency of the vaginal canal and the vaginal opening. It can help prevent the shrinking and the narrowing changes, which unfortunately are bound to happen in a postmenopausal woman who chooses not to use any type of therapy and who does not have a sexual partner. Obviously, there are exceptions to this. There are women who actually have a rather permissive vaginal opening due to childbirth trauma. They do not suffer the problem of narrowing and tightening of the vaginal opening like most women do because their opening is already changed by the childbirth trauma to the point where it will not necessarily shrink or narrow to cause discomfort. I've talked about this topic a lot. There's much more to say about different options like laser technology, electromagnetic technology, radio frequency devices. I can continue this conversation in another episode. There are lots of women who use hormone replacement therapy in the form of estrogen, testosterone, or both, and still need help with their vaginal wellness. And in general, keep in mind, you don't have to choose between estrogen or other technologies. Lots of women have the ability to use both. And now that the FDA black box warning on transdermal estrogen, vaginal estrogen, and other forms of estrogen has been removed, thank God for that, women are more aware that, wait a minute, I was told for 20 years estrogen is bad for me. It turns out they were wrong. Estrogen is not bad for me. So I will catch you next week with an up-to-date discussion on vaginal technology that is capable of improving genitourinary syndrome of menopause. Because let's face it, there are many circumstances when women are sensitive to estrogen. They cannot tolerate estrogen, and estrogen is not always the solution for everyone. There are hopefully 9 out of 10 women that will enjoy estrogen and will benefit from estrogen, whether it's a short-term or long-term. However, even in those cases, such technology will come in extremely handy and will be very useful to know. And there's such a cloud of insecurity and which one does it work, which one should I choose, that I'll try to narrow it down and give you as much information as possible about the pros and cons and the various benefits, and refresh your memory about what to do in case you get confronted with a significant change in the quality of the tissues down there that require rejuvenation. I will be back next week. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.